All right, so for the next half an hour, I'm going to introduce you to a concept that's relatively new out there. It's called psychological safety. And we're going to talk about what it is and what it isn't, and actually how to improve it in your facility. So, what are we going to cover the next 15, 20 minutes? We're going to define psychological safety. We're going to look at why it matters and how to improve it. So, first, what is psychological safety? It's a shared belief held by members of a team that it is safe for interpersonal risk taking without fear of retribution, being humiliated, or harshly criticized. Amy Edmondson, she believes that psychological safety is the soil, not the seed of a culture in an organization. It is the soil. But what psychological safety is not, it doesn't mean that if you have a psychologically safe environment, it doesn't mean that people will always agree with one another for the sake of being nice. It also doesn't mean that people will offer unequivocal praise of unconditional support for everything that you have to say. But it is about radical candor and making it possible for productive disagreement and a free exchange of ideas. So we like to look at psychological safety as the process of erasing fear from organizational life. So in healthcare, psychological safety is a concept that refers again to the belief that no one will be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. In hospitals, psychological safety can have numerous benefits for healthcare providers, patients, and the healthcare system as a whole. So here are three top benefits of psychological safety in hospitals. Number one, improved communication. When healthcare providers feel psychologically safe, they're more likely to speak up and communicate effectively with their colleagues up and down the leadership chain. This can lead to a better coordination of care, fewer medical errors, and improved patient outcome. In addition, healthcare providers who feel safe to speak up are more likely to share ideas and innovations, leading to a culture of continuous improvement. It also leads to a dramatic increase in employer satisfaction and retention. When healthcare providers feel psychologically safe, they're more likely to feel valued and supported by their organization. This can lead to higher job satisfaction and retention rates, which will reduce the costs associated with turnover and training new staff. And it increases patient safety. Psychological safety can lead to a culture of transparency and openness, which can help identify and address errors and adverse events. When healthcare providers feel safe to speak up, they're more likely to report errors quickly for corrective action and near misses, which can help prevent future incidences and improve patient safety. Psychological safety is one of the core components of the Institute of Healthcare Improvement's framework for safe, reliable, and effective healthcare. And according to Frontiers in Psychology, in a psychologically safe environment, healthcare professionals are empowered to voice their concerns and share their experiences, leading to, again, improved error prevention and innovation. And a study published by BMC Health Services Research found that psychological safety in healthcare was positively associated with patient safety. Another study published sorry, I mentioned that one. So what happens when there's a lack of psychological safety, when people don't feel comfortable speaking up? We know about safety issues like this. We know when there's a wet floor, we put a sign up and says, be careful, wet floor, don't slip. And those are the obvious safety concerns. The ones that we're concerned about is when there's invisible silence. Wherever you work, is that a failure of an employee? Is there a failure of an employee speaking up at that crucial moment? See, it can't be seen in that moment. And this is true whether the employee is on the front line of customer service or sitting next to you in an executive boardroom, because not offering ideas is an invisible act. It's hard to engage in real-time course correction. When people see something unsafe or wrong and fear reporting it, people might feel bullied or intimidated by someone, and then they don't report it. Fear of speaking up can be hazardous to human health, and this could lead to widespread dysfunctions, anxiety, depression, and even physical harm. So here's a case study that happened in a hospital. It's about two premature twins that were born, and they were considered high risk. But fortunately, they were in a busy urban hospital, and they were in a neonatal care unit. And there was a young nurse practitioner named Christina, and a silvered-haired neonatologist named Dr. Drake. When Christina looked at the baby, she was concerned. Her recent training had included, as newly established best practices, administering a medication that promoted lung development as soon as possible. The neonatologist came up to the babies, looked at their chart, wrote down a couple of things, and he began to walk away when Christina stepped forward to remind Dr. Drake about the medication that he didn't administer for the baby's lungs. She caught herself. Last week, she overheard him publicly berate another nurse for questioning one of his orders. She told herself that the twins would probably be fine. After all, the doctor probably had a reason for avoiding the medication, still considered a judgment call, and she dismissed the idea of bringing it up. Besides, he had already turned on his heels and he was off to his morning rounds. We call this an unconscious calculator. In hesitating and in choosing not to speak up, Christina was making a quick, not entirely conscious risk calculation, the kind of micro assessment most of us make numerous times a day. And most likely, she was not even aware that she had weighed the risks of being belittled or berated against the risks that the babies might, in fact, need the medication to thrive. And she told herself that the doctor knew better than she did, and she was not confident he would welcome her input. So inadvertently, she had done something that psychologists call discounting the future, underweighing the more important issues of patient health, which could take some time to play out, and overweighing the importance of the doctor's possible response, which would happen immediately. In the end, the babies were fine, and they survived without this medication, but still, this could have been a disaster. Another situation that happened in 1997 about workplace silence is when two 747 jets collided into each other and burst into flames, and over 580 people died in that accident. In summary, what happened in this situation was that the runway was fogged in. It was a small airport. There's a Pan Am flight ready to do their takeoff roll, and there was another plane. And the pilot of the airplane decided that they were going to he was going to take off regardless of having clearance from the tower. The co-pilot, and at that time the engineer, knew that they did not have clearance, but they chose to not speak up out of fear of what the pilot might say to them, out of fear of the retribution. And unfortunately, because of that workplace silence, there was another disaster where, again, over 580 people lost their lives. Let's change gears and let's envision what the psychologically safe workplace could look like. So remaining silent due to fear of interpersonal risk can make the difference between life and death. We know that airplanes have crashed, financial institutions have fallen, hospital patients have died unnecessarily because individuals were, for reasons having to do with the climate in which they worked, afraid to speak up. This fear has also led to disgruntled employees, workplace violence, and even extreme measures of depression. Really, this doesn't have to happen. If you look at just Christina, for example, if she felt psychologically safe, she would have not hesitated to ask the neonatologist whether or not he thought treating the newborns with the prophylactic lung medication was warranted. Here, too, she might not even be aware of making a conscious decision to speak up. It would just seem natural to check in. She would take for granted that her voice was appreciated. She even would want to lead the change in patient care. So in a climate characterized by psychological safety, which blends trust and respect, the neonatologist might quickly agree with Christina and call the pharmacy to put in the request, or he might have explained why he thought it wasn't warranted in this case. Either way, the unit would have been better off. The patients would have received the medication, or the team would have learned more about the subtleties of neonatal medication. Another reason why we need psychological safety is that right now we live in what's called a VUCA world, where it's volatile, uncertain, complex, and ambiguous. And the rate of technology is increasing at a faster rate than we are as human beings. So, in this world, we need to learn how to cooperate. We need to be able to work as teams more effectively, which that key ingredient is psychological safety. A number of years ago, Google did a study where they studied 180 teams. It was called Project Aristotle. And their goal was to find out what ingredients were needed to create the best teams. And what they found out was that psychological safety was that key ingredient. That even if you have extremely smart and high performing employees like Google had, the need for psychological safety contributes to the talent they had to offer. The teams also found other factors that helped explain team performance, things like clear goals, dependable colleagues, personally meaningful work, and the belief that their work had impact. So, how does psychological safety drive innovation? And there's innovation, there's technological innovation, there's also innovation in how businesses operate, how units operate. And it's interesting when we look at this quick chart here that leadership without psychological safety tends to be more controlling and toxic. With psychological safety,
Mm.
they tend to be more inquiring, things happen from the bottom up, and they're more mission driven. Employees without psychological safety comply, hide mistakes, and maintain their reputation. With psychological safety, they may challenge ideas, they may learn from mistakes, and they serve the mission. And innovation is stifled by the need to preserve the status quo without psychological safety. And with psychological safety, everyone is encouraged to adapt and try new solutions. When Amy Edmondson was doing her work at hospitals, she had another premise in that she believed that she would find that high performing teams would actually have a error reporting rate that was going to be very low, and low performing teams were going to have a very high number of errors. And when she did her study, it was flipped, and she didn't understand it at first. And as she continued to research this, it dawned on her that what was happening was the low performing teams were hiding their mistakes. They were sweeping them under the proverbial carpet. They weren't reporting them for quick corrective action. High performing teams, because they felt safe, psychologically safe, they were reporting mistakes immediately. So quick corrective action could be taken. So, what is the road to psychological safety? In order to achieve psychological safety, people need to be accountable for their behavior. There is above the line behavior, which improves psychological safety, and there is below the line behavior, which decreases psychological safety. Now, in order to have that accountability, there must be sufficient trust in one's relationships. And trust must be sufficient for team members to hold each other accountable for their behavior. To build trust, people must know how to communicate with one another and understand the complexities of interpersonal communication, and to engage in conversations, especially difficult or challenging conversations. People must be developed in emotional intelligence. And in my opinion, emotional intelligence is the foundation to achieve psychological safety and high performance. So, how do we measure psychological safety? When we measure psychological safety, we're actually looking at it on four different axes. Number one, what is the willingness to help? To what degree are people willing to help each other? The next axis is attitude to risk and failure, the degree to which is permissible to make mistakes. Third degree is inclusivity and diversity. We flip it in the world of psychological safety. So when we look at this, we're looking at the degree to which you can be yourself and you are welcomed for this. You're welcomed for your various ideas, thoughts. And before you can really have diversity of thought, there must be inclusion. And finally, a willingness to help. The degree to which people are willing to help each other is measured. When we look at this, this is just an example of a potential assessment or case study. When we look at over a 6 to 12-month period, we first have to set stakeholder goals and alignment. And then we do a baseline assessment. And then we do an intervention, which could look like training, coaching, presentations, various ways to improve psychological safety. And along the way, we keep measuring that psychological safety to make sure that we're moving in the right direction. Just wanted to share with you a sample of a report. And this was one of the baseline reports that I gave to a very high performing team. And what you see on the screen right now is that we measure it from 0 to 100. The gray one that's in the back, that was the first assessment that we gave before we did any intervention. The boxes that are scattered across this area is which each individual participant, that's where they rated. The dotted line in the middle shows the medium of each other. So you can see that when we first started, the median was about 68, and after a couple of months, it moved up to about almost 70. And so we consider this to be successful after a very short period of time. On attitude towards risk and failure, you can see that there's even a bigger increase in risk and failure or being able to take risks in this organization. And just another example, open conversation. You can see that when we first did this, it was way down, like on 55, and after an initial period, it shot up to about 80. So these were very exciting results that yes, we can improve psychological safety on teams. So what are some practices that you can use right now to improve psychological safety? Number one, in creating psychological safety in hospitals, it requires a long-term commitment that involves everyone from the top level administrators to frontline healthcare professionals. The IHI recommends taking the following steps to promote psychological safety in healthcare. Number one, foster open communication by encouraging staff to speak up and share their thoughts and feelings. Build trust by creating an environment where staff feel comfortable sharing their experiences and ideas and also their mistakes. Promote teamwork by creating opportunities for team building and collaboration, and encourage a just culture by rewarding staff for demonstrating courage in speaking up and sharing their experiences, even if an error occurred. Here are some more tips. We already mentioned, work on improving emotional intelligence across the entire organization. Avoid the blame game and criticism, especially in front of others. Develop your interpersonal dialogue skills, communication skills. Along with that, build interpersonal trust. Be accountable for your own behavior first and build enough trust in your organization where others can have conversations when they see somebody exhibiting below the line behavior. We like to say, see it, own it, solve it, and do it. Engage in coaching conversations, develop leaders and managers and how to work with employees in a coaching conversation, which breeds more trust and development. Embrace ideas from everyone. Remember, in a psychologically safe environment, not everybody's ideas are going to be acted upon, but when you consider everyone's ideas, people feel more comfortable to contribute. Become a learning organization. Learn from your mistakes. Express gratitude and recognition when warranted. Don't gossip. You've got to get rid of the gossiping in organizations. And then check your ego at the door. There is really no room for ego in a psychologically safe environment. And finally, we want to focus on learning, not just the results. Bear Bryant said, when you make a mistake, there are only 3 things you should ever do about it. Number 1, admit it. Number 2, learn from it. And number 3, don't repeat it. C.S. Lewis said, humility is not thinking less of yourself. It is thinking of yourself less. And Lou Holtz said, I never learned anything talking. I only learn things when I ask questions. And now we can take any questions that you may have.
Robert, what a great intro on day 2, following especially Kevin's presentation yesterday, when we really got to talk about getting past discontent. And I really feel like if you had true embraced psychological safety in your organization, you would not have that discontent. So again, great job. So thank you. All right, we've got a couple things going on here in the chat box for you.
All right, let's have it.
The first one, statement: fear of retribution for entering an event report or mentioning a safety concern has been a common experience for me in healthcare. And I think that's common for a lot of people. What can you do with that?
How can we mitigate or lessen the fear of retribution?
Yes.
It comes from the top down. It comes from the C-suite always down to the front line, as we mentioned in the presentation, that creating a culture where it's okay to admit your mistakes so we can take corrective action, again, has to come from the top. I understand why people are afraid to admit mistakes. When I was working for a company, I was afraid to admit mistakes because I knew my manager would yell at me or I might get terminated for it. But when I had my own company later on, I created an environment where anybody could admit any mistake. And then afterwards, we talked about it. Afterwards, we turned it into a learning opportunity, but it has to come from the top.
Yeah, I agree with that. And I also believe that we have to acknowledge when these things are reported so that the staff know that it's being taken care of, it's being addressed, they are heard. Yeah. I think that is another piece of it that we can add into that. Next question. I truly believe in this. How would you suggest we start to promote this within our staff? But I want to take it a step further, looking at, do you have a policy on this? How do you really embrace and communicate it to staff, but then demonstrate it at the same time?
It takes constant work on this. And again, the first place to start is really working on communication, open communication, and emotional intelligence, so that when these situations occur, there isn't a reaction to it, but we're responding to those situations.
Wonderful. Next one. Any tips and best practices for how to manage disrespect and insubordination in the name of radical candor, especially in small teams? Again, I love that too.
Yeah. The number one tip I can give you in this situation, and listen, it's not easy. Okay. This is not an easy thing to do, to manage insubordination or rudeness on a small team. Number one, do your very best to handle any conversations in private. Do not do it in a public forum. That will backfire big time. And the conversation that you can have with somebody is try to help them understand their impact on the team. I would avoid using the word you, and I would avoid using the word but when you have these conversations. And you might want to say something like, I've noticed that when there's behavior like this on our team, it doesn't lead to team cohesion. What are your thoughts about that? And try to engage in that conversation. That's a good first step.
Wonderful. Next one, though. How do you recommend we get rid of office gossip?
There's no magic wand for that either, unfortunately. And as you work towards building psychological safety, you can address the gossip issue. You can address how disruptive it is, how destructive it is. And then we start talking about empathy. If you're doing the gossiping, how does it make you feel when you think some people are gossiping about you? Again, I keep saying it's not easy. It's such an important process, though, to begin to eliminate gossip. It can be addressed directly. Right? That's again the above the line, below the line behavior, right? Hey, we're committed to an environment of psychological safety. And I would ask somebody, do you like a psychological safe environment? Do you want to be able to speak up freely without fear of retribution? And if they were to say, yes, I do want that, and I might mention to them again in private, gossiping is what we call below the line behavior. It does not lead to psychological safety. There's always the chances of something like that having other implications afterwards, but we have to start somewhere. And it does involve taking some risks.
Yes. All right. Before I get to the next question, we have another statement here. Fear of retribution needs to be replaced by courage to care. I like that. I might
That's
do that.
beautiful.
It takes
Beautiful.
bravery to be countercultural and leadership to present a well-reasoned position across the system.
Mm.
Amazing. And I would love to keep that quote. That one was great.
Real quick, I'll share another quick ski patrol story from my very early days. My first year on ski patrol, I got called down to an accident that was at the bottom of the mountain, and all we knew was that somebody was hit by a snowcat, right? The big machinery. That was the call. And so I was told to take the sled down and get down there, and I was skiing down. And there was a point in the mountain where I could go straight and it was faster, or I could turn right and I was going to be a little bit longer. While going straight, there was ribbon across saying run closed. I thought to myself, big deal. I know there's snow. I'm going to go that way. I'm a patroller. It's okay. Well, I started skiing down and I came across dirt and rocks. And I literally had to kick off my skis and drag the sled across these dirt and rocks till I got to snow again. And I was a wreck. And I got down to the bottom of the hill and we took care of this person. The snowcat didn't hit this person. The tripped and landed on the snowcat. And afterwards, I went to the team leader and I broke down in tears. And I admitted my mistake and I offered my resignation from the ski patrol for that mistake. And he looked at me and he smiled and he said, "Thank you for admitting the mistake. I'm sure you'll never make that mistake again, will you?" And I said, "Never again." That was like, I didn't know it back then, but that was psychological safety.
Yes. What a great leader. Here's a great plug for you and your company. How do you increase emotional intelligence on your team? Whole session.
That's a whole session, right? It's a whole session. The first step is to understand what emotional intelligence is. And I'll summarize it like this. The main things that we learn to do in emotional intelligence is that we learn to not react to situation and take that pause, understand we're having an emotional reaction to something and respond instead. And it really is about taking that pause and getting your thoughts together. Of course, those of you who have been through one of the workshops know it's not quite that simple, but that really is the process. It's something that is learned.
It is. So how do we get leaders to let go of their control?
Put them through a CLS leadership program. It's interesting. It's a great question. And what I have found is that leaders who control too much are not confident in their own leadership. Right. And that's usually what I would call a background conversation that's occurring that they're not even aware of it. It really leads into emotional intelligence. Right. And so leaders, once they begin to own their leadership and have confidence in their leadership, then they can become better leaders. When there's psychological safety, a leader should feel comfortable saying to somebody else, Angie, I want to handle the situation differently. And I know that in the past, I handle it by controlling and manipulating, and I don't want to do that anymore. That's a really brave thing to say to a colleague or even a subordinate. How could I lead this situation better? That takes a lot of psychological safety, a lot of bravery, and zero ego. I don't necessarily recommend that you go out the gate doing that, but that is something that I've coached some of my leadership clients to do in the past, and it worked out very successfully for them.
Wonderful. Last one I have here.
Hey.
How do you encourage someone to speak up when discipline may be the outcome?
So if discipline's the outcome, either it's a very egregious act of some sort, or it's not the first time that they know that they've been notified that something about their behavior was inappropriate. I think that, and I'm not sure what level of discipline we're talking about here. It could be termination, could be that level of discipline, but perhaps the organization needs to embrace a culture where termination is only used for a very egregious act or after a number of opportunities for this person to improve. So that's a tough one. That's a tough one.
Yeah, and that makes me think of a scenario. Back in my hospital days, we had a really bad trauma come in, and it was a truck driver, and he was violent and he was not good at all on the trauma table, and we were trying to kind of get him secured. And I remember him hitting a nurse. And immediate reaction was she hit him back. Best trauma nurse I had. And she hit him back and left a nice little bruise on his head. But there was discipline, but nobody wanted to speak up at first and say, hey, we need to own what happened in the trauma room. And they
Yeah.
didn't document it at the time. They were trying to cover, but they knew discipline was going to come from that. And that's what I think of when I think of that and how you really handle that.
Yeah, and also I wonder too that if somebody admits readily that they made a really bad mistake and that they recognize that there might be discipline, how might a hospital or any business for that matter handle a situation like that where the person who committed the act was very forthcoming about it?
Yep.
So, but finally, if policies are really clear, that might help as well.
Yep. And unfortunately, we had a couple more come in, but we have run out of time.
Okay.
So, Robert, thank you again very much.
Thank you, Angie.
Great session. Lots of questions and feedback from everybody. So, thank you again.
Good. All right. Take care, everybody. Enjoy your day.
So, if you guys want to hear more about Robert and the things he offers, please reach out to the CLS team. He really has a lot of great platforms out there.